Hey, everybody. Welcome. I'm Ellen Sachs. I'm the founder and faculty director of the Sachs Institute for Mental Health Law Policy and Ethics here at the USC Gould School of Law. This is our 12th annual symposium, and we're really jazzed to be here. Our topic today is COVID-19 and mental health. When we were contemplating what our topic of the year would be, I was fearful that COVID would be gone by the spring, and of course, thrilled with that idea. But that is not how things have turned out. People are still struggling through the pandemic, and our conversation today remains meaningful and important. I would like to take a moment to thank supporters of the Sachs Institute, including the Sidney R. Bear Foundation, the Doris Bree Trust, the Anthony and Jean Pritzker Family Foundation, the Richard and Christine Getz Foundation, my former student Jacqueline Klein, and numerous others for their generous support. I would also like to shout out a big thanks to our law school events department and the town and gown staff for doing such an amazing job, in particular Layla Landers, who coordinates all of the Sachs Institute events. And finally, I want to send out a special thanks to Chris Schneiders. He's more than someone who just works for me. He's a collaborator and a friend. We do everything together. Thank you, Chris. Today we bring together multiple stakeholders from our community, both as presenters and as attendees. Perhaps most important, we involve peers with lived experience of mental illness. That is always our priority and our policy. We also include family members, including people at the National Alliance for Mental Illness, mental health professionals and organizations, police officers and sheriffs, as well as students and professors from across the university and other institutes of higher education. So today our program will occur in 4 sessions. First, COVID-induced delirium and psychosis. Second, long COVID. Third, frontline healthcare professionals. And 4, therapy in the time of COVID. I also want to shout out a special thanks to Pam Belluck, Pulitzer Prize-winning New York Times health and science writer, who helped us put together this program and identify excellent speakers. She's written extensively about COVID and mental health, helping open up a dialogue about what is happening and how to address it. We couldn't have done our program without her. So I hand things over now to you, Pam. Many thanks.
Thanks so much, Ellen. Can you all hear me okay? Well, thank you all so much for coming. It is really great to be able to gather together. And it's really an honor for me to be involved in this program and to work with the phenomenal Ellen Sachs just the amazing work that she's done and the example that she sets. And Chris Schneiders has been just tireless and terrific to work with, and Layla Landers has been wonderful as well. So it's a neat experience to be kind of part of organizing this event, as well as being on stage to help you all hear from the speakers that we have, who are really coming from across the country and lots of different walks of life. So thank you for being here. So our first panel is about COVID-induced delirium and psychosis, and we're splitting it up. Delirium the first half, psychosis the second half. Our delirium speakers were the only ones who couldn't travel, so I recorded a conversation with them ahead of time, and we're going to start off by showing you that on the screen, which is over there. So please take a moment to shift your seats. The first session of the Sachs Institute Spring Symposium. I'm Pam Belluck. I'm a health and science writer for the New York Times, and I'm here with Dr. Wes Ely, who is a critical care physician at Vanderbilt University in Nashville, Tennessee. And I'm here with Kim Victory, who is studying to be a medical lab technician. She lives in Franklin, Tennessee, and she is a person who has experienced COVID-related delirium. And so we're very interested in hearing about her experience. And so Kim, I wanted to start with you. I know you got very ill with COVID in March of 2020, so 2 years ago, and you were actually hospitalized at Vanderbilt. You were on a ventilator for 13 days, and you were in the hospital for about 3 weeks. So it was quite an ordeal, and you are young, you're 33 years old, and previously healthy. And so I know during that time you experienced really profound delirium, and so would you just tell us, give us a sense of what that experience was like for you?
So when I woke up in the ICU, the first thing that's in my mind, I was in Japan. It's some sort of like lab or hospital. And I tried to make sense of that, like I was sick, too sick that people in America cannot treat me, so they had to send me to Japan. And I told the nurse that I am American, I want cheeseburger and Coca-Cola, which I don't do that normally. And then I zoned out of that. And the next thing that I remember was being kidnapped in Mexico. My husband helped to try to get there, and some sort I get burning alive during that, and then passed out. The next thing I remember was I was on like a ship, and I have a wee mask. It seemed like to me I was like in an ice sculpture, and I have a wee mask, and I on my face tried to get it off. And then somebody get in the room and say, Mrs. Victory, let me help you with that. And then I just passed out. That's how I remember in the first couple of days after I get out of the delirium, the ICU. And then I remember that when I was still in the ICU, I kind of fell out of the chair during lung time. And I thought people tried to kill me, get me poisoned. Yes, and just crazy stuff happened.
Sounds
and I don't know.
Yeah. Wow, that sounds really terrifying. And all of that was happening in the space of a few days, right? You were on a ventilator during some of that time, but not all of that time. Right.
No. It's just the first couple of days, because after that I got out of the regular room. Yeah.
So, Wes, Dr. Ely, I'll call you Wes, you know, you were actually one of Kim's doctors, but you have a lot of experience prior to COVID and during COVID times now with delirium. Can you give us some sense of context here and you know, just give us some reflection on both Kim's experience and kind of the wider experience?
Sure, thanks Pam, and thanks to the audience for being here to help learn about how these patients suffer. And Kim, I just want to validate that what you went through, I don't understand how much that must have caused you suffering, and I can't truly relate to how much suffering you went through, but I'm glad that I had the privilege of being present with you in the ICU. It was a privilege to take care of you, and it does my heart so much good today to see you in recovery and living out a great life, even though I know you're having ongoing problems, which we'll get to. In terms of your delirium, this is a very, very good description of the hallucinations and delusions that so many millions of people have experienced during COVID. And I've been studying delirium and critical illness for 25 years. And what I'll say is similar and different is that it's similar in that people with severe sepsis and on ventilators and that sort of thing have been telling me for 25 years that this is the kind of experience that they have. But COVID patients have it in spades. They have it more, longer, more severe. And the reason is that what's happening in your brain is that COVID is really a vascular disease, and a lot of small blood vessel clots occur in the brain, and so those neurons, those cells that keep us thinking clearly, downstream from those blood clots are not getting enough food, water, oxygen, and blood. And when that happens, those neurons are all just screaming because they abnormally, and so you start hallucinating, and what it really represents is a global dysfunction of the brain and the injury that is actually going on at the brain level. This is not just a benign side effect or a sideshow of your illness. This was a major part of your illness, the COVID itself, and you did a great job describing that.
Thank you, Wes. So Kim, you know, I know that, you know, you had, that was sort of your acute experience of delirium, but after you got off the ventilator and you were sort of recovering in the hospital, you continued to have experiences as well. Like you continued to struggle, and I think maybe not as much kind of frightening visions, but you had, you know, kind of difficulty as you were trying to get healthy enough to be able to leave the hospital. Describe what that was like and what happened during that time.
So after the ICU, I got to the regular room. However, there's no family contact. People come in and out with the suit and mask. It's very isolated because I was by myself in the room. I didn't get any sense that I thought I'm gonna go home after a couple of days. Because after I heard the doctor say like, oh, she looked good, she can go to the regular room. So was in my brain, I was thinking like, yeah, just maybe a couple of days and then I get out. However, it's lasts like longer than I thought. But like when the nurse, every morning they come into my room and check out, they ask me like, what the day today? Who is the president? And it took me such a long time to understand, to process that, to get the answer out of that. And then I remember, so I called my husband at least like 15, 20 times a day, just so I telling him that you need to come to get me out of hospital. You need to come pick me up. And he kept explaining to me that I'm not well enough. I'm not ready to go home. And it's not, every time that he say no to me, I just thought, like, no, I'm not accepting that. I'm trying enough, I get out. During that, when I shut him up, I keep thinking in my head, like, okay, who am I gonna call next to get me out of the hospital? Even I don't have anything closed, yes. It's a hard time for me just like to understand what the state I was in. So I remember that one, like right before I gotta go home, the doctor actually wanted me to go to a rehab center. But I told him like, I'd rather jump out of the window than you go send me to the rehab center. I think that's where to the state that I really struggle to understand how bad I was, and I still don't understand that today.
Wow. And then after you got home, your life, you know, was completely changed in a lot of ways. I know you and I spoke probably a couple months after you had gotten home, and you were still struggling with a number of different issues that you'd never had before COVID. Tell us what some of those have been, just in the sort of, you know, soon after you got home from the hospital, what that was like for you.
Soon after I got home, I have difficulty to sleep. I been awake for a couple of days in a time. In the daytime I was okay, but as soon as it's dark outside, I feel scared. I have to turn all the light in the house. I even go to bed with a light on. It's very difficult for me at that time because basically I just stay home all the time after got out of the hospital. Before that, I was active. I went to school, but it suddenly just stopped. Just stay home, yeah. And depression, I feel I'm in a worse state. Whatever I were is just a burden for my husband and my family. Um, I don't normally say that, but I wish I would die. It's so difficult to keep living at that point. Um, I told my husband that I wish I should die. Um, it's nothing here. I cannot get better. It doesn't sound like me.
I'm so sorry that you were experiencing that, and thank you for sharing that. Takes a lot of courage to describe that to an audience, so thank you. Wes, do you want to talk about the kind of thing that you've used in other patients as well?
Yeah, this is incredibly moving, and as clear of a description of the vagaries, the disaster and disabling features of critical illness and COVID as I've ever heard before. So Kim, thank you for your bravery in describing this. Let me put this in perspective from several different angles. First off, during COVID, we studied 2,100 COVID patients in the ICU, and we found that the two main things driving the delirium that you experienced, Kim, were the overuse of sedatives like benzodiazepines and the underuse of family. And many times you said, I was calling my husband, indicating he wasn't there with you. And this is something that we did wrong. We shut down family visitation. It was absolutely wrong. It was anti-medicine. We did it because we thought we had to, but it was wrong. And right now, I just want to make a plug for anybody hearing this to ask their local hospitals if their visitation is reopened, because it should be now. We know that PPE works. We know that family visiting a loved one is not a luxury. It's part of the healing plan. We can't heal you, Kim, without the touch and the love and the reason to live that your husband, Wes, provides you. Science is not enough. There has to be technology and touch. The second thing I want to say is that we have ways of preventing some of the disabilities that you experience, the delirium, this depression, clearly the post-traumatic stress disorder that you have, which depression and PTSD occur in about 1/3 of all people who get out with COVID. And we have a safety bundle called the ABCDEF bundle, but the compliance rates went from 80% down to 10% during COVID. So we have to rebuild our uptake of these things that we have proven work. And the last thing is that I want to say is that as you've been going through these many months, what's going on at the neuronal level in your brain is that your brain is saying to itself, can I fix this? Can I get it back where we were before? And this is neuroplasticity. And so your brain is struggling and working very hard to rebuild those connections. And that's why we're using computer games and computer rehab right now to get people's brains back. And I think hopefully that offers hope to many people around the world when they hear your story that we can get your brain back. And all of the science that we're working on at our center at Vanderbilt, the Critical Illness Brain Dysfunction Survivorship Center, indicates that we can make great progress for you.
Thank you, Wes. Kim, you're 2 years out now from this experience, and I think it would be really helpful for people to hear what your life is like now. You've had, some good news in that you have entered into a medical lab technician program, and I think you're on track to maybe graduate in about a year. Is that right? Okay, that's great. And but you're still having some of the struggles. I think, I think you know, been, having some therapy and treatment for your depression, right? So can talk about, you know, what you're experiencing now, what is going, you know, well, what is going not so well, you know, what's your journey been like?
It's been hard for the last 2 years. I've been online school a lot, and then suddenly school opened back up. We have to go face to face. I have a hard time to introduce myself, stay home all the time, doing everything online to actually go out to meet people. It's give me that anxiety. When I what out the hell, what gonna be, who's gonna be next to me? Is that person gonna be healthy enough to be next to me? I'm gonna get COVID again? And I, unfortunately, that my friend who in the same class, she got COVID second time, and it's got my brain like went crazy, worried, like, well, we been masking, we in the track to become a healthcare profession, we've been taking care of ourselves, and we still got this the second time. What could it be? Will I gonna be survive that next time? Like, and then that is one thing, and depression, I still have to deal with that. School is hard. Don't take me wrong. I know a lot of things harder than this, but school is struggling. I used to do good in school, and now I see my grades just not what I want. I haven't been that success in school, and it gave me another thing like, will I'm going the right direction for my unit. I have to consider myself as I am not a healthy person. I have to accept that I have depression. My brain is not 100% like I would before COVID. I have to accept that. It's really true. I can't deny that. I have a hard time to reading book, cannot concentrate on my book, my studying. It just lie day to day. It just is a question for me, how I'm gonna keep going today, how it's gonna go, how my future gonna be. Will I be 100% recover? It's a lot to take in for me right now.
It does sound like a lot, and thank you again for you know, being generous enough to share that experience. I think many COVID survivors are experiencing a lot of the same kinds of things that you're talking about, you know, so I think that sharing that is going to be very helpful to people who are going through it and others who haven't experienced it themselves, but maybe you know, it's good if they can understand what others are experiencing. Wes, can you sort of put this into a larger picture for us and what you've seen with COVID survivors that you've treated and that you've studied?
Sure, I know we're close on time, so I'll be brief, but take Kim's description of her life and the disability that she's experiencing and the honesty with which she described it. We don't know exactly how many people have long COVID, but it's been estimated, just in the U.S., there were 20 million people are suffering in this way. And so if you've blown her symptoms out on a large scale across just the U.S. alone, and then think globally across the entire world, we are dealing with a massive public health catastrophe that we have never seen in our lifetime. And that is going to play itself out over the next 20 to 30 years as these people suffering, like Kim is suffering, try to go back to work and be the breadwinners for their families or be the matriarchs, the patriarchs of their families. And we have to reckon with the truth of this as we go forward in time. So the depression, the PTSD is one thing, but this acquired dementia, and it's hard to use the word dementia when we're talking about somebody who's 33 years old, but it is a form of memory dysfunction and executive dysfunction that looks phenotypically a lot like dementia. And this is something that long COVID sufferers are describing in spades. They call it brain fog, but we can call it dementia too. And so I just want to close on the note of that we have to show mercy. And my working definition of mercy here is to dive, Kim, into your chaos with you and provide lifting and healing in some way. And that's what, as a medical professional and as society at large, what we want to do is to dive into your chaos, be present with you, and then lift you and heal you to the best that we can, if nothing else, just by our presence and by listening to you and being there for you.
Thank you so much. And Kim, I'd like you to, have the last word here, I guess. Is there anything that you would like to say about your experience, to others? If you wanted to leave people with a message or with something that you think people should be aware of, what would that be?
For me, a lot of people that I got feedback from is COVID now is not that dangerous like when I got it. It's a mild case. We don't die. People don't die because of COVID anymore. Well, maybe put it that way. But the long term of what we have after COVID is the one that I'm more concerned than, dying is easy for me. To be, honestly, for me, at the point I'm like, well, dying is easy. It's done and gone. But how we keep living is more important. And to be concerned about that. And it's not, we get out of the hospital as being you healthy. It's not. It's still continue every day. You still have to deal with it. And another thing is, when I first got this, I thought I went crazy, and I thought I'm the only one have all these symptoms. And lucky for me that I know there are people have the same thing with me. I want people to understand, to know that if you have these symptoms, you're not alone. We can do it together. And I think that will help a lot more people to know about this. A lot of people will recognize that they need help and they get help in time. That's what I want.
Thank you so much. And I think the strength and the self-awareness that you're showing is so admirable, and you are continuing to live, and you're continuing to make your life as healthy as you possibly can, and you're moving forward, and that's just a wonderful thing. And so I wish you all the best in your continued journey and your continued work that you're doing. Thanks very much to both of you for joining us for the SAC Symposium, and we'll end here and continue with the rest of the symposium. Thank you.
Thank you.
Okay, that was Kim's story, is very powerful. So now I would like to introduce the two gentlemen to my left. Dr. Colin Smith is Chief Resident in Internal Medicine-Psychiatry at Duke University Medical Center, and Ivan Agerton is founder of the Lost River Film Company. Ivan and I crossed paths. I guess it's been over a year now, right? When I was fortunate enough to connect with him while he was going through a very powerful experience. And so, Ivan, why don't you start off and give us a sense of what you were going through after you got COVID?
Yeah, after I got COVID, I had a mild case of COVID. I had isolated for about 10 days, and just a few days after I came out of isolation, I received a spam phone call. Spam, sorry, not Pam. Spam. Spam phone call.
It's a common confusion.
And this light switch went off. I started experiencing extreme paranoia. I felt like people were watching my every move. And for about 36 hours, I was convinced that law enforcement, government agencies were listening to me via my cell phone. Just having the cell phone there and just them listening through my cell phone. People, any car that drove by, anyone that walked by our home, I was certain that they were tracking me. And so I would go outside and try and get eyes on the vehicles, and it was terrifying. And so for about 36 hours this was going on. I finally decided I needed to tell my wife what was happening, and so I had her put her cell phone down, and I pulled her into our closet in our bedroom and whispered to her and told her what was happening. And she immediately went into protector mode and called some friends of ours and got me to the emergency room. But it was a terrifying 36 hours. It was horrifying. Auditory hallucinations. At one point, I had downloaded a police scanner app, and I was listening to the chatter, and I was convinced that they were talking about me, and it sounded very specific, like he's out walking his dog right now, and I was in fact out walking my dog. So there was this overwhelming voice that was happening. But the whole while I was also saying, this is not right. I don't know why this is happening to me. And so we loaded up at that point. A friend of ours told my wife to get me to the emergency room right away. And so we loaded up the car and went to the emergency room and was admitted to a behavioral health facility in Seattle, Washington.
And, just for sort of background, I think what's important to know is that this was a completely new experience for you. Like you had no previous history or family history, right, of any kind of issue like this, any mental health history?
No history whatsoever. My extended family, there's no history of this. And I'm used to stressful situations, and so it was one of these things where, the terror was just overwhelming.
Yeah. And when Ivan says he's used to stressful situations, tell him what you do.
I'm an expedition-based photographer and cinematographer, so I do a lot of work for National Geographic and BBC, and also shoot documentary films. And so usually we're in pretty tough environments. And right before this had happened, I had been in the Middle East for 2 months, and came back, and that's when I contracted COVID. Was on the flight back.
So Colin, you have, I think, treated at least one case like this, and I know you've done a lot of research on post-COVID delirium. Just sort of from what you've heard, can you reflect on Ivan's experience and what you've seen and learned about?
Yeah, definitely. Thanks, Pam, for, first of all, can everyone hear me? No. Okay, great. There we go. So used to Zoom now. I was muted. First of all, thanks, Pam, for shining a light in your writing on kind of the experiences of people, not only who have had delirium related to COVID, but also psychosis. And Ivan, for thank you for coming here, for be willing to share your story, be vulnerable, in kind of sharing your experience with everybody. Proud really just to be sitting next to you, kind of in this moment with you. You know, and you're not alone in your experience, right? We heard Kim talk about her experience with delirium after COVID, and delirium can have features of psychosis, right? And some of the things that you're talking about, core features of psychosis, you talked about paranoia, for example, right? So when we think about psychosis, it's really a collection of signs and symptoms, which can be caused by a number of different things, right? So delirium can have kind of psychotic features, and separately from that, other conditions, medical conditions, viruses, and medications, for example, can cause symptoms of psychosis. So at our institution, we've had the opportunity to work with individuals who've had similar experiences to your own, right? Who have not had a history of mental illness, or substance use, who have come in with acute onset of feeling like others were out to get them, for example. This was entirely new, came on suddenly, also had hallucinations, so seeing things, hearing things that other people aren't, similar to what you were describing. And then in most of the cases that we have been seeing at our institution, and really that have been described across the peer-reviewed literature, oftentimes within weeks, these symptoms are resolving, a lot of times with medications and sometimes without medications. And so I think that the ongoing research is showing that although it's rare, SARS-CoV-2, the virus that causes COVID-19, has been increasingly associated with people developing similar symptoms and signs to what you were experiencing.
Thank you, Colin. Yeah, so Ivan, let's continue with your journey. You went to the hospital, and even on the way to the hospital and getting there, you had some profound experiences, right? So can you sort of just describe that, and then like your time at the hospital, and what that was like?
Sure. Yeah, on the way to the hospital, before we left our house, I was convinced that a roadblock had been set up, and that as soon as we left the house and we were driving away from our house, that this roadblock and these government agencies would descend on me. That didn't happen. It made me feel good that didn't happen. But we had gotten on the ferry to Seattle, and once we showed up to the emergency room, there was what appeared to be an unmarked police car. And as soon as we pulled in, that police car left. And as I'm sitting in the ER waiting room, my wife had left because she couldn't stay with me. So as I'm sitting in the ER waiting room, these two plainclothes, what I thought were plainclothes police officers, had come in. And I was convinced, this is it, they've got me. And so I just sat there, and they left. And so that was the experience, just getting to the hospital. Once in the hospital, it was, that was a terrifying experience. Getting into the hospital, the lighting was really bad in the mental health, behavioral health ward.
He's a photographer, so he pays a lot of attention to lighting.
Yeah, it was out of a bad horror film. Anyway, so checking into the hospital, there really wasn't an understanding from us yet. I think my wife had actually found a friend of hers had sent the article that you had written in the New York Times, and my wife had sent that to me and also to our doctors, and they started, kind of putting two and two together, I guess, at that point. But I spent 10 days in the hospital there, and getting my medications set, and started feeling better, actually, by the time I was released. I don't know if I skipped anything, but...
No, I think
Okay.
Unless there's something else that you want to share. Yeah, so this was, I think, like, I remember you were in the hospital. You actually had to miss Christmas with your family, right? With your kids, and because you were there. This was December 2020, right? And so yeah, and so the understanding of, I mean, I don't think, there was very little, if any, kind of mainstream understanding of, that psychosis could be precipitated by COVID. So your doctors were kind of, scrambling and trying to figure out.
Yeah, most of the research that we had found, and one doctor in particular, Dr. Zantop, who's in Seattle, she had found research based out of Europe and started looking at this research. And then also I tuned her to your article so she could read through that. And she really actually sat down with me. Out of the doctors that were on rotation, she's the one doctor who actually sat with me and had conversations with me, and did a lot of pro bono, I guess you could call it, off our research into what I was experiencing and the research that we had provided her. I don't think without her support, while I was in the hospital, I think I would have had a really rough go in the hospital. But because of her support and her understanding, I was able to navigate it.
So then, just to get to the next sort of chapter there, you're home, and you're taking medication, and what starts, things start to get better, right? But what happens?
Yeah, I'm feeling a lot better actually, and I was on two medications, and they seemed to be working really, really well. And then I had a trigger where I saw an article, some police raid somewhere, and it just came flooding back. And the paranoia hit me again, almost harder this time. And so I went back to the behavioral health ward for another 7 days, I think it was. And I got through it, and I felt safe at this hospital, safer than I did at home, quite a bit. And so it felt good to be there, and the help I was receiving was fantastic. They had put me actually in a different part of the hospital when on my second visit, so I wasn't, as my first nurse described to me in my first hospital stay, this is where the suicidal and homicidal come. And so this is the environment that I was in. The second round, I was in a slightly looser, I guess you could say, part of the hospital. So I wasn't surrounded by. To me at the time, I'd never experienced anything like this before. So to be in this room with these people that were obviously mentally disturbed, it was a frightening experience. And I was thinking, is this me now? Is this who I've become, and will I be like this for the rest of my life? I wasn't sure.
Thank you for sharing all that. Colin, I wonder if you can talk about, I know you've done sort of a whole review of worldwide the cases of delirium, and one of the things that I think you and others have told me in my reporting that I found really interesting was that, these are the kinds of symptoms that doctors are used to seeing maybe with people with schizophrenia, or often sort of dementia-related psychosis. But usually that happens either when people are very young, right, in teens or early 20s, or on the older end of the spectrum. But a lot of the cases that we're seeing of COVID psychosis are people like Ivan, are you 50 now, 51? And people 30s, 40s, and 50s are kind of, in the prime of their lives, no previous history. And then the other thing I thought was kind of interesting is Ivan describes it with such a self-awareness that he knew something was wrong. And I don't know how typical that is. So if you can maybe reflect on those things and any other insights that you think are helpful, you know.
Yeah, definitely. We did a review where we looked at kind of all the reported cases of COVID-related psychosis in the past 2 years, really around the world. And at that point, when it was published, there were about 40 separate publications describing 48 different cases. Of course, not every case of every illness is published in a medical journal. And we found that, can you still hear me? Okay. We found that the average age of an individual who was diagnosed with a new diagnosis of psychosis in COVID-19 was early to mid-40s, right, which would be inconsistent with a new diagnosis in general of a primary psychotic disorder, so schizophrenia, schizoaffective disorder. Traditionally, we think of those occurring earlier in men, for example, 18 to the 20s, in women sometimes a little bit older. There's also a little bit of a bimodal distribution, or women are sometimes diagnosed later than men are. So that's kind of one of the initial kind of findings of this review of cases that we saw. So certainly different than we would expect in a primary psychotic disorder like schizophrenia or schizoaffective disorder. You mentioned the comment about insight, right? Ivan, you talk a lot about the sense that something was off for you, right? And we describe that as insight. And for a long time, we've thought about insight in individuals who are living with a psychotic disorder or experiencing psychosis as a marker that things are going well, relatively. And I think the fact that a number of these cases are occurring in individuals who have not had previous mental illness, it makes sense that you and other folks would have kind of greater insight into the fact that they're not doing well, not feeling well, feeling like their thoughts or behavior are out of character for them. Their families are noticing that as well. So those are some of the things that we pointed out in our review. I think it's also important to point out that this is something that is rare. There was a group that looked at over 200,000 diagnoses of COVID-19 and compared new diagnoses of depression, anxiety, and psychotic disorders, and compared those diagnoses to individuals who had other illnesses like influenza or other respiratory viruses. And this group found that people with COVID-19 were more likely to receive a new psychotic disorder within the 6 months following an infection compared to other people who had similar medical illnesses like influenza or respiratory virus infection. That percentage overall is quite small, but it was significant. So I think it's important to point that out. Also important to point out that I think probably a portion of those cases were related to delirium. In listening to Kim's case, for example, or her story, you could see some of the overlap of the things that you were experiencing. And so teasing out what is the exact cause of the symptoms that you're experiencing, I think is really important because it helps us think about, how do we work with you to develop the best treatment plan. Yeah.
Oh, that's really, really interesting. So Ivan, since then, so you had your second hospitalization, and so that ended maybe a little over a year ago, right? And you've continued treatment and, sort of describe what your last year has been like, both progress and setbacks and anything else.
Sure. Yeah, it's the last year I've been able to work a few different times. I took some time off to rest and try and recover. So I was on an expedition for about a month, and that went well, I think. And then came back, and then I started getting this depression kind of set in a little bit. Just kind of, I think, just being out of it for such a long time, out of work for a long time. But the medication seemed to be working, and so I was feeling really good with the exception of this depression. And so my doctor and I decided to start tapering the medication. And one day we were driving to the ferry again, and there's a police station right next to the ferry terminal, and I thought I saw the same two guys that I saw when I first checked into the ER, standing in the parking lot. And I just looked at my wife and said, "Here we go again." And she said, "Well, all police officers look the same, so don't worry." No offense to Table 17 over there. And so I called my doctor right away, and she got me back on my full regimen of my original prescription, and it's been fine. This happened about 2 weeks ago, if I remember right. So I've had I've had ups and downs, more ups than downs, but it's definitely it's still terrifying, and I'm looking forward to the day when I'm 100%. So, yeah.
Yeah. Well, thank you for sharing that as well. I mean, I guess it's not necessarily a linear journey, right, Colin? Like, is that typical? Is there anything that we can say about what people should expect, or?
Yeah, I think that what we know right now is that the majority of people that have had similar kind of experiences that you've had with COVID and experiencing psychosis, a lot of symptoms resolve within the first couple weeks, first couple months. We know even from the 1918 pandemic, when individuals had psychosis related to influenza, similar picture, where a lot of symptoms resolved early on, and after follow-up at 5 years, the vast majority of people no longer had symptoms. But certainly your experience is consistent with kind of a group of other people who have initially improved and then have kind of these waves of additional symptoms that come back. I think it's really important to emphasize the relationship you have with your psychiatrist and your treatment team, and how important that's been. I know you've shared that with me before and hinted at that now, that relationship is really important in your recovery.
All right. And then just to sum up, I'll ask you the same thing that I asked Kim. Ivan, is there anything that you would like to leave the audience with that you think would be helpful for them to understand?
The big thing for me, and something my wife and I have talked about it quite a bit, is just having our advocates in place, people that are there to support us and guide us through a journey like this. And just making sure that people have their advocates in place before they get sick is probably the one thing that, out of all of this, without the support of my wife and without the support of our friends and family, this would have been a really difficult road. It still was difficult, but it would have been even more so.
Well, that's very good advice. Thank you so much again, and I'm wishing you all the best. So we have time, I think, for 2 questions, very short. Yes, there are microphones there. If anybody would like to come up, we'll try to get Ivan and Colin to answer. Don't be shy. Okay. Well, then we will take a break. Thank you very much to Colin and to Ivan. Really appreciate it. And thanks to Kim and Wes as well. And we have, a 10-minute break? Okay.